All right, so next up, part 4 or 5, can heart failure go into remission? So again, this is part 4 of the second universal definition of heart failure. I'll link the official paper down below. The update describes heart failure as dynamic with defined potential for improvement, remission, and progression, replacing the prior framing of heart failure as a fixed unidirectional diagnosis. This formalizes the existing heart failure with improved ES classification, an increase in at least 10% points on follow-up and follow-up EF above 50%. A patient presenting with new cardiomyopathy at 50% EF, for example, treated with standard 4-pillar GDMT who reaches 50% EF at 6 months follow-up echocardiogram now falls under a defined diagnostic category rather than being documented as atypical or unexpected outcome. Relevant evidence on treatment and withdrawal. The TREAD heart failure trial evaluated GDMT withdrawal in patients with recovered EF from dilated cardiomyopathy who were asymptomatic and had normal EF at the time of withdrawal attempt. Relapse, defined as drop in EF symptom, recurrence, or biomarker elevation, occurred in approximately 40% of patients in this trial within 6 months of stopping therapy. This indicates that improved EF reflects an ongoing pharmacologic effect in most cases rather than resolution of the underlying disease process. It is not established that withdrawal is unsafe in all patients, only that relapse risk is substantial enough to require structured monitoring if withdrawal is considered. Clinical application for patient communication. EF improvement should be communicated as a change in trajectory that is dependent on continued GMT, not as resolution of the underlying disease. The term remission is more accurate than improved or recovered for this purpose, since it specifies that the current status depends on continued management, consistent with its established use in oncology, for example. Documentation implication: heart failure with improved EF should be recorded as an active diagnosis requiring continued GDMT, not as resolved or historical heart failure. This distinction also affects eligibility criteria for clinical trials and device therapy, since trial enrollment and ICD indications are frequently tied to current EF diagnosis status rather than nadir EF at presentation. Next up, we'll be talking about social determinants in the new universal definition of heart failure.